Hello everyone, my name is Alvin Paulos. I am an assistant professor, School of Data Science, Indian Institute of Science, Education and Research, Thiruvananthapuram. During this talk, I would like to discuss about permissible use of AI in health professional education. Most of my discussion I exploring the ethical and practical implication in this topic. During the discussion, first I like to discuss the following contents. So we start with the introduction about the AI in health education, then followed by current landscape of AI in health education, potential benefit of AI, then we will like to discuss about key application of AI, then ethical consideration, best practices, potential pitfalls, managing AI deployment, then for framework for responsible AI use, future research direction, then finally I conclude my discussion. So when we start with the introduction about this topic, we start discussing about the brief overview of AI in health provisions education. So we can look at the definition of AI. So AI composes machine learning, natural language processing, robotics, and other technologies that mimic human intelligence. This is the basic definition of the AI in the context. So when think about the current application, AI is used in personalized learning, simulation-based training, intelligent tutoring systems, and administrative tasks. These are the most popular and advanced application of AI currently using in our application oriented scenarios. So when we consider about the evaluation, so from basic computerized tools to advanced adaptive learning system which integrated with the healthcare training. So during our this talk we discuss more about the healthcare application and how the AI is involved in health professional education. So the importance of this topic. So when we discuss about the AI in healthcare, the first we have to think about the revolutionizing education. So AI has the potential to transform how health professionals are trained, then making education more efficient, personalized and effective. So when we doing this revolutionary education, then what is the next thing we can consider about the improving patient care? So by enhancing the education of healthcare professions, AI indirectly contribute to the better patient outcome. So this is our main goal, to introduce AI in the healthcare system, basically improving the patient care in one dimension. Then the other one is keeping pace with the technology. As healthcare technology advances, integrating AI into education ensures that professionals are equipped with the current skills and knowledge. So the objective of this presentation mainly I would like to talk about the explore permissible usage. So in this objective I would like to discuss about the identify and discuss the ethical and practical application of AI in health professional education, then followed by some highlight benefits and challenges. So in this context provide a balanced view of how AI can enhance learning outcomes while acknowledging potential ethical and practical concerns. Then I would like to talk about the present best practices. So in this context offer insight into successful implementation strategies and guidelines for responsible AI integration. Then finally the future outlook. So in future outlook I would like to discuss the emerging trends and future direction of AI in health professional educations. So we start with the brief history and evolution. So in the early stages, the initial use of computerized system for administrative tasks and basic educational tools, that was in the early or the olden days, we introduced the computational things basic for the administration work or the basic education tool. Then in the growth phase, a development of more sophisticated systems such as computer assisted learning and early AI application in education. When it comes to the modern era, integration of advanced AI technologies including machine learning, natural language processing and robotics into health professional education, there is like evolving stage. Currently most of the applications we use this concept. So these are the main history behind AI in healthcare and the evaluation. So examples of current application, we start with the personalized learning platform. So the first thing we can look at the adaptive learning. So basically AI system that tailor educational content to individual learning styles and paces. The other important application is customized feedback. So when we do the real-time implementation, the feedback based on student performance to get learning paths, that is a very practical example currently most of the system use. And the other one is the intelligent tutoring system. So in this case virtual tutors, these are very popular and most of the cases we use. So in virtual tutors, AI driven systems that simulate one-on-one tutoring experience, providing personalized instruction and support. And the other most attractive application is interactive learning. So system that engage students with interactive content, assessments and feedback. Then followed by the intelligent tutoring system, the next popular application we can consider is simulation based training. So virtual reality, which is a very hot topic, and the augmented reality. So in this context, the immersive environment that replicate real life clinical scenarios for hands-on practice. So most of the healthcare application, the importance of the vital role of virtual reality and the augmented reality is like immersible. The day by day the usage of this virtual reality is increasing, so it has a wide application in AI in healthcare when we consider the virtual reality or the augmented reality. Then the other one is the simulated patients, so the AI powered virtual patients that help students practice diagnostics and treatment skills in a risk free environment. So this will be reduce the usage of humans, and also we can keep some risk out from the real experiment with the human body rather than the simulated patients. So the potential benefit of AI. So next I would like to discuss about some of the benefit when we introduce AI in the healthcare. So the enhancing learning outcome. So basically the first we can discuss about the personalized learning experience. So AI adapts content and assessments to fit individual student needs, improving comprehension and retention. Then the other important benefit is the real-time feedback. So immediate actionable feedback allows students to correct mistakes and understand the concept more deeply. Then the another crucial benefit of AI is the engagement and motivation. So interactive and gamified AI tools can increase students engagement and motivation. So these are the major potential benefit of AI when we introduce AI into the healthcare systems. Then comes to the other points in potential benefit of AI. This is like streamlining administrative process, which includes basically automated grading and assessment. So AI can quickly and accurately grade assignments and exams, and saving time for educator. Then the other one is the scheduling and resource management. AI system can optimize schedules and manage educational resources efficiently. Then the data management, so the centralized systems for tracking student progress, performance analytics and administrative tasks. So these potential benefit of AI gives more advanced usage of AI in healthcare systems. Then followed by the other potential benefit of AI, we can consider supporting clinical decision making, which includes clinical simulation. So AI driven simulations provide realistic clinical scenarios for students to practice decision making skills. Predictive analytics, so AI can predict student performance trends, helping educators intervene early and provide target support. Then the evidence based practice, so AI tool assist in teaching evidence based practice by providing up to date research and clinical guidelines. Next we can consider the key application of AI. The first one is tailored educational content. So AI customized learning materials to meet the unique needs and preference of each student. For example, adaptive quizzes, personalized reading list and customized practice exercise. And the next one is like adaptive learning pathway. In this context, the AI can adjust the difficulty and the progression of learning activities based on student performance and comprehension. So the most example in this adaptive learning pathway is the interactive problem solving sessions, personalized tutoring sessions, and automated hints. And the virtual reality and augmented reality, previously I explained about or discussed about the role of virtual reality and augmented reality in the context of AI healthcare systems. So when we consider this virtual reality or augmented reality, the technology that create a realistic clinical environment for hands-on practice. So the most popular example when we use the virtual reality or augmented reality is the surgical simulation or emergency response scenario and the patient interaction training. Then the last point is about student performance and curricular development. So in this context, the AI analyze students' data to predict academic outcomes and identify areas for curriculum improvement. And best examples for the student performance and curriculum developments includes early warning system for risk students, data-driven curriculum adjustment, and personalized learning plans based on performance trends. Then next I would like to discuss about the ethical considerations. So when we consider the ethical issues related to this scenario in this topic, the first one is ensuring data privacy. Most important ethical consideration, data privacy is very crucial. So the first point I would like to discuss about the data protection. So we should implement a robust security measures to safeguard students and patient data. The data is very crucial, and revealing the data gives some ethical consideration. So we must make sure that the data is not publicly available, or the data privacy or data policy we should keep before revealing the data content to the outside. And the other one ensures compliance with the regulation like GDPR and HIPAA rules. So some type of regulation we strictly follow to protect the data or to keep the ethical consideration. And the other one is the consent and transparency. So it's a very important point normally we have to keep in our mind. So obtain and inform consent for data collection and usage, very critical point when we consider with ensuring data privacy. And the other one is to clearly communicate how data will be used and stored, so that the users or the end users the where the data collection is happening. So the trainers or the patient or the student who are involved in the data collection, they should be properly communicate what is the purpose of the data collection. If they used to for research, we should get a consent from the participant, like these data is strictly used for research purpose or study purpose, and also inform them or communicate with them like how we use this data for further application oriented, or where we keep this and the further usage of this data. So the consent and transparency and data protection, these points are very crucial when we consider about the ethical consideration. The other ethical consideration is mitigating biases in AI algorithms. So in this context, we can consider or think about the algorithmic fairness. So develop and test AI algorithms to ensure they are free from biases that could affect learning outcome. Then the other one is use diverse dataset to train AI systems. So basically the checking the quality of the algorithm or AI algorithm or how they implemented. And the other one is the continuous monitoring. So we have to keep in mind that regularly audit AI systems to detect and correct biases. Also encourage feedback from users to identify any bias related issues. Then the next one is maintaining humanistic aspects of healthcare. So in this context, the first point I would like to discuss about the preserving empathy and compassion. So ensure AI tools complement and not replace the human elements of healthcare education. And the other one is emphasize the importance of empathy and patient-centered care in training program. So the other ethical decision making in this context, which includes like teach students to use AI as a tool for informed decision making rather than a replacement of their judgment. Then the next one is like include ethics training in AI and technology use within the curriculum. So using the AI in the healthcare system, the ethical consideration is very crucial, most important, and strictly the usage should follow most of the ethical consideration before usage of these AI systems in healthcare applications. Then we would like to discuss about the best practices. So in this best practices, the first thing is about is the drawing from current research. So basically it includes the evidence-based approaches, a continuous learning, and the other thing is like we can look into the case studies and examples, basically a real world application or lesson learned. Then successful implementation. So in this context, like we can think about the integrating AI into curriculum, the collaborative effort, valuation, and feedback. Next, I would like to discuss about the potential pitfalls, so which includes reduced human interaction, dependency on technology, algorithmic errors, quality of data, bias and discrimination, transparency and accountability, privacy concerns. So when it comes to the reduced human interaction, which includes the risk of diminishing the importance of human touch in education and patient care. Also there is another potential decline in critical thinking and problem solving skills among students. So the next point, when we consider the dependency on technology, which also like include the over dependence on AI tools, which might lead to complacency in learning and teaching. Also the another importance of balancing AI use with the traditional teaching methods. Then when it comes to the algorithmic errors, like AI system can sometimes provide incorrect or misleading information that also may make so many confusions at the end users. And the other one is a consequence of relying on inaccurate data for educational decision. So the algorithmic errors also create a significant impact on potential pitfall contest. And the other one is the quality of data. So AI accuracy is highly depends on the quality of the input data. If the data doesn't have the diversity or the amount of data and the quality of data, that also matter the performance of the entire system. Then the risk associated with using incomplete or biased dataset also gives some issues when we introduce the AI system to the healthcare applications. Then bias and discrimination, in this context, like we can say that AI algorithms may perpetuate existing biases in data, leading to unfair treatment of students or patients. Also importance of ensuring fairness and inclusivity in AI applications. So this bias and discrimination is another key pitfall when we think about the AI in healthcare systems. Then transparency and accountability, in this case the challenges in understanding and explaining AI decision making process. Also the need for clear guidelines or accountability for AI driven decision in education and healthcare. The last pitfall, which is about the privacy concern. So the risk related to the handling and protection of sensitive student and patient data, it's a very crucial parameter or the consent when it comes with handling the data for the AI contest. Then the necessity of the strict adherence to privacy laws and ethical standards, which also another parameter affecting the privacy concern. So these are the main potential pitfalls when we think about the AI in healthcare systems. So the next important parameter when consider in this context is the managing AI deployment. So in this case we can start first about the aligning with the educational goals and professional standards. So in this scenario, first we have to think about the clear objective. So in this case, like define how AI tools will support specific education outcomes and professional competitions, or ensure AI application align with the overall mission and values of the education institution. Then the other thing is that the standard compliance, so adhere to the established guidelines and accreditation standard in health professional education. Also incorporate AI use in line with the ethical and professional standards. So the other point regarding the managing AI deployment is the continuous monitoring and evaluation. So in this case, regular assessment, which includes like implement a mechanism for ongoing evaluation of AI tool effectiveness and impact on learning outcome, and they use matrices and analytics to track performance and identify areas for improvement. And the last point in AI deployment is the training educators and students on AI tools, which includes the comprehensive training programs. So provide educators with the training on how to effectively integrate and use AI in their teaching, like offer workshop tutorials and resources to help educators become proficient with the AI technologies. And the another thing in training educators and student on AI tools is the organize some orientation program to the students or the usages, which includes like introduce students to AI tools early in their education, explaining their benefit and limitation. Incorporate AI literacy into the curriculum, teaching students how to use AI responsibly and effectively. And the last parameter we can think of in this context is the support and resources, so which include mainly create support systems including help desk and online resources to assist educators and students in using AI tools. Also encourage a culture of continuous learning and adaptation to new AI advancements. Next, I would like to discuss about the framework for responsible AI use, basically which include the ethical use of AI. So we already discussed about the most of the ethical concerns when we introduce AI in healthcare professions. Then the informed decision making, also the student centralized approach, deployment and implementation, interdisciplinary collaboration, continuous improvement, then human AI partnership, then empathy and compassion, holistic education. So these are the most of the framework for responsible AI use in the healthcare professions. Next, I would like to discuss about the future direction. So following are the most of the future research direction you can think about the AI in healthcare application. So AI driven personalized learning, and the other point is like enhanced simulation technologies, data driven decision making, integration of AI across curricula, also the AI enhance interprofessional education, ethical AI frameworks, and also the effectiveness of AI in education, AI and human interaction, bias and fairness in AI. So these are the future research direction you can think about when we introduce AI in healthcare professionals. So finally, I like to conclude my discussion. So in this talk, first we discuss about the like AI is basically transforming the health professional education through personalized learning, intelligent tutoring, simulation based training, and predictive analytics. So also the usage of AI enhances learning outcomes, that streamlines administrative process and support clinical decision making. So most of the application include personalized learning platform, intelligent tutoring system, simulated based training, and predictive analytics. So when we consider with the ethical concerns like ensuring data privacy, mitigating biases, and maintaining the humanistic aspects of healthcare are very critical. So these parameters we have to be make sure that the data is protected, and most of the human risk are less. So these parameters normally we consider when we use the AI in the healthcare professions. Then they're drawing from current research, leveraging case studies, and ensuring successful implementations. So these are the future research direction also we can think about that. So thank you for your attention, and if you have any questions and discussion, please discuss.